Yes?
Yes.
Cool. All right. So just a little bit about what we're going to go over. I'll give you a brief introduction of who I am and why I'm here. We'll talk about what are vaccines, how they work, vaccine-induced illness, and that's actually plural, illnesses, vaccinosis, puppy shots, that's a special category of vaccinations. And then what can you do? And we'll get into the titer testing. Okay. So I am not a veterinarian. I am a passionate mom of kids and pets. And I've been using natural products for 12 years. And I've been teaching other people how to use natural products to support their health and their pets' health for 7 years. We do not diagnose, treat, or cure any ailment. You need to, or I'm sorry, my research is based off my own personal experience and research into what other people are doing. I highly encourage you to take the information that you're getting here and use it to do your own research, because every situation is different. Every pet is different. This information is not to replace your vet's advice. And I encourage you to always be your pet's advocate. All right, I don't know if you can see this. So these are my pups. I'm not going to say that I'm partial to German Shepherds, but I'm partial to German Shepherds. I rescue senior medical dogs, and all of these guys have passed away except for the one in the middle, Samson, who I've had for like 10 weeks. And so this is where I get my research and my love. I mentioned that I rescue senior medical dogs. So when they come to me, they've been at the shelter and they have been given every imaginable vaccination and pest product. So my job with them is to detox them. I learned about this when I came across this beautiful, handsome German Shepherd that someone was posting about in one of the groups, who was at the emergency vet and suffering from kidney failure. And so in asking the pet owner what the history was, this was a 2-month antibiotic treatment for a chronic ear infection. And during that 2-month period, the vet gave him his full annual vaccinations. And then Charlie went into kidney failure. They thought it was leukemia. I can't even imagine how many thousands of dollars they spent trying to help him live for a week. And then they finally had to put him down. The point is that vaccinations should never be given to an animal that is ill. And so having this knowledge so that when you go into the vet with your animal, you can question things and you can say no. This is your animal. You know them better than anyone else. The vet is a professional that you can work with, but ultimately you have the final say. And in this case, if they had known this and not given Charlie those vaccinations, he would not have died that painful death. So that's how I was learning about this. So why do we vaccinate? Just like with people, they're preventative, not curative. They protect our pets from contagious diseases, and it protects against transmissible diseases to humans, like rabies. The way they work is a small amount of the disease is administered into the vaccination, and it goes into the body and stimulates the immune system to generate a protective immune response. Sounds good, right? They take a while to work, and they are not always effective, but it's important to know that vaccines work better in a healthy and relaxed animal. Imagine that. It takes about 7 days for the body to respond and develop the immunity. So you don't want to give your pet these shots if they are sick, because they can be very dangerous. Dr. Jean Dawes is one of the vets that I follow. She has done a lot of great things in the holistic pet world. And she has said that both allergic and autoimmune diseases have been on the rise since the introduction of the modified live virus vaccines. So these diseases, along with cancer, organ failure, and skin inflammation. So if your animal has allergies, it could also be related to vaccinations. And then another veterinarian said that routine vaccinations are probably the worst thing we can do for our animals. They cause illnesses, but not directly to where we would relate them to the vaccine. So that's always an issue when you get the vaccine, your animal gets sick, and then the vet says, oh, no, that's not related. So vaccinosis is related to rabies. And I just want to mention here that rabies is the only vaccination that is required. The only vaccination, only one. So all of those cards and calls that you get from the vet saying it's time for Fifi's annual shots, the only one she has to have is rabies. And we'll talk about that because that's another discussion. So vaccinosis can start with vomiting, diarrhea. It can cause paralysis, anaphylactic shock, and even death. So I don't know what the percentage is, but we don't want any of our animals to be that percentage. A lot of times when there is damage from vaccinosis, it can be permanent. So it can be mental or emotional. It can be aggression. It can cause a problem with balance and the brain. And some breeds are more susceptible than others to the adverse reaction. So again, the autoimmune and the anaphylactic shock are really devastating reactions to the rabies shot. All right, so puppy shots. It's really cool that when puppies are very young, they nurse from their mother. Colostrum gives them the immunities that they need. And when they get the shots, if they have the immunity from their mother, the vaccination doesn't even work. It overrides it. So that's a good reason to be mindful of when the puppies get their first shots. There are, in the vaccinations, there are toxins that can cause all kinds of horrible reactions. So not only does the vaccination contain the virus or the disease, but it also contains a number of other ingredients. Unfortunately, we will never know what those ingredients are because they're all proprietary recipes. And so we assume that they have mercury, MSG, aluminum, formaldehyde. These are meant to stimulate an exaggerated immune response. They also can cause damage that will last a lifetime. All right, so when I go to my vet with my animals, they're older, they're sickly. I already know that they shouldn't be getting any toxins put into their body because their immune systems are already weak. And so I always knew that intuitively, but now I know we take care of our animals, keep them healthy, and find ways to make sure that they don't have more toxins put into their body. And the first way we can do that is with a vaccine titer. I didn't know anything about titers. Again, my seniors just didn't get shots after I got them. So it's just a simple blood test, and the blood is tested for the different diseases. For the most part, again, the only one that's really necessary, especially for an older dog, is rabies. And the blood is tested to see if it has the immunity in the blood. And Nancy can attest to how long the initial vaccination can last. One of her dogs was still had immunity after, was it 16 years?
Wow. 17.
17 years. So these annual shots are nothing more than moneymakers and additional opportunities to make our dogs and cats sick. So again, it's a simple blood test. It validates whether the vaccination has resulted in immunity. I found this was really interesting. By titering a pregnant female for parvo and distemper, you have a more precise way to determine when to start the puppy vaccinations. So it's always, for the puppies, I can't imagine being in a position to try and navigate that and figure it out. But there's a lot of support out there. There's a lot of information. There are so many people like you and me who know that the system is set up to help to deal with illness. But what we want to do is support wellness. So if you are going to vaccinate, for starters, you only want to do the core vaccines, and that's the parvo, distemper, hepatitis, and rabies. All the other shots that they talk about are non-core. And again, if you don't know any better, you get a card once a year and they're going to give you all the shots, the core and the non-core. And if your animal has allergies, which means that they're sick, they shouldn't be getting any of them. So this talks about even the recommendation for the core vaccines every 3 years, which has since changed to every year. The requirement or the recommendation for this is baseless. And the booster vaccines do not increase immunity, they do increase the likelihood of illness. So going into your vet, if you don't have a holistic vet, there are some great ones out there, but not everybody has access to a great holistic vet. So knowing what your animal needs is going to set your animal up for more success. All right, so when do you want to revaccinate? Well, when you get your animal vaccinated, a titer test after 4 weeks to check and see if they develop the proper immunities. Some pets like Nancy's will be protected for life. Some, for whatever reason, maybe they were too young and the maternal immunity overrode it. And so you'll have to do it again later. But the only way to know for sure is if you do the titer. Dr. Rob is one of the pioneers of fighting for reducing the toxins that are being put into our animals' bodies. And he was offering titer testing for anyone up until probably a month or two ago. He's getting older and has decided, probably for legal reasons, to close the practice down to only his immediate patients that come into his clinic. You can imagine the pharmaceutical companies and how they are trying to keep him from changing the landscape of these annual titers, which are a huge moneymaker for them. So when I first learned about the titers, and my older, I don't know how old, senior Tinkerbell was becoming, it was time for her to get her rabies. And I knew that that just wasn't going to happen. I asked my vet here in Inglewood about getting a rabies titer. And that was 3 years ago. And he told me that it was relatively new and that it was $250 for one rabies titer. That is significantly higher than what is being charged from these other facilities that are offering this service. So if you ask your vet and it's not something that they are doing or they're charging a ridiculous amount of money for, there are places that you can go or mail the blood samples to, and they will do it for a reasonable amount of money. With the Kansas State Diagnostic Lab, they are offering a direct link to veterinarians. So getting veterinarians on board with this, getting them to understand the value and the importance of this is something that is only going to happen if the patients start demanding it. So as far as vaccination safety, only vaccinate healthy animals. Revaccination is a decision between you and your veterinarian, and you have the ultimate say. Vaccinations can cause lifelong problems. And we talked about the maternal antibodies that can affect the vaccination of young kittens and puppies. So here's the map of the states that require a rabies vaccination. And there are groups, and I'm going to talk about in a minute, that are on a mission to have laws passed that accept exemptions for the rabies vaccination, and using these titer tests to show that the immunity is there. So Texas, we'll have to get more information on this, what each of these mean. But the big one is the states that are white that have no exemptions. So again, this is pet parents making noise and saying, you know, we're not going to stand up for this. There are some exemption, or I'm sorry, there's some alternatives that you can use for vaccinations. No-sodes are homeopathic remedies where they take some of the actual disease from a diseased animal and then orally or nasally inject it. It's not an injection, but get it into the animal for the immunity to build up. And then sometimes for whatever reason, or if it's puppies and they're just getting their first shots, it's really important to detox before and after. So set the body up for best health, and then after the shot, detox to get all of those extra adjuvants out of the body. And just as an aside, thuja is a homeopathic remedy that is used to help with that detox, and arbor vitae contains thuja. Another option, and I don't know if this is something that is available internationally, but this is a company in Israel, and they have created 3 different testing protocols and machines that they are offering to veterinary clinics. And so again, another option, if you have a vet, you have a good relationship, you can mention that this is something that would be helpful for the vet business, but also helpful to minimize vaccinations for these animals. And then Dr. Jean Dodds is in Garden Grove, California. She has hemopet.org, and that is another place that you can draw the blood, send it to her lab, and she will test the blood for the immunities to determine the titer level, so that if the blood contains the immunities, then the animal doesn't require further vaccinations at that time, unless it's rabies and you're in a state that doesn't accept that yet. I'm hoping to do a follow-up with a group of people who are on a mission to pass legislation so that the requirement for the rabies vaccines is more for the health than it is for the pharmaceutical companies. So this is a great group. They have a website, they have a Facebook group, and they are currently working on legislation in Arizona to get that passed so that they are not required. Okay, so now I'm looking, sorry. All right, playing it forward from working with Dr. Rob. Nomograph tells you when the mother's antibodies drop off, knowing exactly when a vaccine may be more effective. Did you want to talk about that? Yeah. So the titers for pets, Patty, did you want to jump on and say anything? Cavid's lab at University of Wisconsin does nomographs too. They published an article showing how a schedule approach leaves 14% of puppies unvaccinated, not immunized. Okay. Patty, are you there? Oh, okay. And I didn't mention, I'm not Krista. I'm Sherry. Using Krista's account. So, like I say, let me see if I can stop this share. I wish I knew how to. Do this. Were there any questions on Facebook, Nancy?
No, just a couple comments that
Okay.
mostly I did.
Okay.
Let me just double check.
All right. Oh, stop share. There we go. There we go.
Candace wrote, can you message me the vet info that is Garden Grove?
Yes. Yes, I can. Yeah, I'll put all of the contact information with the recording. All right, so I'm going to stop the record. And stop